So in this section, we'll be discussing the diagnosis of death. The diagnosis of death, as I've already told you, it's mostly clinical. So the signs to be noticed in a person has to be are discussed in this section. The clinical tests performed by a physician to diagnose a death are discussed in detail. The modes versus the cause of death and the post-mortem changes are then discussed in detail in this section. Now, the diagnosis of the brainstem death. The signs of death which are established in a person, which have to be done by a physician, are that a person is deeply unconscious and he's not aroused by any painful stimuli, by any physical stimuli, by any chemical stimuli. He cannot be aroused. So that will establish that he is deeply unconscious. Now, no spontaneous respiration. This is basically the apnea test. There is no spontaneous respiration until and unless the patient is artificially respirated by putting him on a ventilator or something. Then there are no reversible metabolic conditions. A lot of people basically undergo hepatic conditions which are reversible. So in this case, when we are establishing the death of a person, there should be no reversible metabolic conditions. And we have to make sure that the person is not under any drug intoxication, because drug intoxication can also mimic all these conditions. The person can be deeply unconscious in drug intoxication, the person will not spontaneously respire, and he will be in a state of deep unconsciousness. Now, lastly, no hypothermia. So there will be no hypothermia at this stage. These are all the signs of death, basically the deep unconsciousness, no spontaneous respirations, no reversible metabolic conditions, no drug intoxications, and no hypothermias. Now, the post-mortem ocular changes. Now, a lot of changes in the eye occurs after death, and some of them are the immediate changes, and then we have the late signs. Now, the immediate changes, we have the dilated or the fixed pupils, the absence of the corneal and the light reflex. When the physician will throw a light by a torchlight or something, there will be no pupillary response to that, and that is basically the absence of the light reflex. There will be marked decrease in the intraocular pressure. The late signs, we have the cloudiness of cornea. Now, why does this occur? It can be due to the cellular debris, and it can be due to the dust particles in the atmosphere. Then we have the increase in the potassium levels. Now, increase in the potassium levels, it's missing over here. It's basically the vitreous humor. In the vitreous humor, there will be an increase in the potassium levels. These tests can be performed, and these are basically the late signs of the ocular changes we have to keep in mind. Then there can be tachynoirs. Now, tachynoirs is basically these scleral images. There will be darkening spots in the sclera. They are basically the tachynoirs, and they can be due to the hemorrhages in the sclera, which are known as the tachynoirs. So these are basically the late signs of the ocular changes. Now, these are the signs which I have discussed in the cornea and in the sclera. We can also examine the retina, and there are some specific signs in the retina which can establish death. There is cattle trucking phenomena in the retina. That is basically the blood cells, the cellular debris basically forms a cattle trucking image in the retinal veins. So that can be found, and the optic disc, when we examine the retina by a fundoscope, the optic disc appears to be pale in a dead person. So these are all the signs of the ocular changes that we establish in a dead person. Now, coming on to the clinical test that has to be performed in a person to establish dead. That is basically both pupils are unresponsive, no corneal reflex. It is followed by no vestibulo-ocular reflex. That will also establish the brainstem death. Now, the stimulation within the cranial nerve distribution fails to elicit a motor response. So this can be performed by different tests, and that will also establish that the cranial nerves are damaged, and that all of these tests can establish the brainstem death at the same level. no gag reflex or response to the bronchial stimulation. So these are all of the tests that can be performed in a person to establish the death of the person. No respiratory effort on stopping the artificial ventilation, having allowed the partial pressure of carbon dioxide to rise above the normal range. So artificial ventilation have to be ruled out, and at this stage we'll examine whether the person respires on his own effort or he is respiring on the ventilator. So that will basically determine whether a person is dead. Now in this slide we are discussing the modes and the manners of death. So the modes of death are basically different, and when you're asked about the manners of death, whether it's a viva voce examination or a written examination, you have to be quite clear that the modes of death includes the abnormal physiological state that pertained at the time of death. X, congestive heart failure, cardiac arrest, and pulmonary edema. No information of underlying pathological conditions is made at this time. And unhelpful or immaterial, the modes of death is basically unhelpful. It doesn't help it doesn't point out towards any crimes solutions, and so it doesn't basically establish anything. Modal terms are quite useless, for example, syncope, coma, and asphyxia. Now, the manners of death are basically what we're focusing in the forensic medicine. The way the death has occurred, for example, suicidal, homicidal, or whether it was a natural death or whether it was an accidental death, we have to establish death as a forensic team expert. Now, the post-mortem changes of forensic importance. Now, after death, there are some early signs and there are some late signs that occur in the human body. The late signs, we have the putrefaction, the mummification. Now, the putrefaction has a lot of variabilities that can happen according to the environmental factors. They are the mummification, the adipocere formation, and the cremation. Cremation is quite according to the religious beliefs of the person. Now, putrefaction is also quite varied by the presence of the predators. The animal predators, if the dead body was lying in an open environment, the putrefaction and all this mummification and adipocere, they're not quite visible in such a dead body because of the animal predators. Now, the animal predators basically assist towards the skeletalization of the dead body. They'll just notch down all these soft tissue body parts of the person, and there'll be a skeletal remain of the person, and that is all what we'll be dealing with. So in the end, there will be a complete dissolution or fossilization of the dead body that will occur after the death. So these are the consequent changes that will occur. On this slide, I haven't shown the early changes that are happening. That is the post-mortem lividity and the rigor mortis. And they're also really important in determining the time since death, the posture the person was while he was dead, and the environment in which he was while he was being killed. So these are the factors that we have to discuss. So in this section, we dealt with the early signs of death, the brainstem death, and what are the factors that will consequently affect on all of these factors. So thank you for watching sqadia.com.